Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello everybody, I'm here with Sharina from RecoveryMum. This is the second video in our series where we're really breaking down borderline personality disorder and looking at some different aspects, specifically driven by questions that you ask as a community, and I really appreciate that. Today we'll be covering borderline personality disorder and anger, which is actually one of the symptom criteria for borderline personality disorder, inappropriate intense anger. So again, I'm here with Sharina, and she has some exciting news that she wants to share.
Yes, my book, I don't know if you can see it, the big book on borderline personality disorder will be available January the 8th. It's available for pre-order now in any bookstore in the world. I believe because it has an ISBN number, or just go to Amazon because their prices are really good and you can leave a review. And within this book I've basically covered the 9 traits of BPD, and within each chapter I delve into our thoughts, our feelings, our behaviours, what's happening in our brain, and also skills, giving you skills that you can put into practice today. There's a section on BPD and work, BPD and men, BPD and sex, BPD and teens. It is a big book, basically. It covers everything. And there's personal stories in there, but I would say definitely self-help. So, yes, go get yourself a copy.
Excellent, excellent. And I'll put all the links, like we talked about, put all the links in the description so anybody wants to go there and find it. I'll put all the links I can in the description for this video. So that's exciting, coming out January 8th. All right, so we'll get started with the questions from the community, and we'll kind of go through them for roughly about a half hour and try to get all that we can for this episode of the series. All right, so the first question here, and again, these are all anger. So first question is, where does the anger come from, the triggers? How can we control the anger, and what are the differences between borderline anger and a person who doesn't have borderline personality disorder, their anger?
Okay, well, I could literally probably talk for half hour just on this question.
That's our one question. There you go.
Yeah, so we've done that one question. Okay, so where does it come from? Like, anger can be a learned behavior. We know a lot of people with BPD, not everyone with BPD, but a lot of people with BPD may have suffered abuse, neglect, some kind of trauma in childhood. Maybe they grew up with a family that had a lot of anger going on around them, and they learned that it's normal just to express your anger all the time. Obviously, not everyone did grow up with anger around them. Some people might have actually grown up the opposite, where they're told they're not allowed to get angry. It's not okay to show your feelings. So as children, they would grow up thinking, you can't get angry, that's bad, and they would hold it in. And for me, suppressing my anger was just as damaging as the times I didn't suppress it, because we just hold on, but we're not actually dealing with it. Now, we've got to remember, anger is a normal, healthy emotion, but BPD anger is different. I'll go into that in a second. It is different, but it is a normal emotion to have, but there's times it becomes unhealthy. If we suppress it and we don't deal with something that's making us angry, it doesn't go away. It will bubble under the surface and bubble, bubble, bubble until you reach boiling point and you go pew, and you explode. So eventually it will come out. The way it comes out can be different in lots of different people. Some people might get physically violent. Other people might turn the anger on themselves and be more inclined to self-harm or punch a wall or do something like that, because there's so many different ways in which anger can come out. So That's what was I saying?
So what causes it was one piece, right? The
I do
triggers,
this a
how
lot.
to
I've got so
control it,
much.
and then has a different, yeah.
Okay. Yes. So yeah. So there's different ways that we can get angry. Like I said, it can be learnt. Sometimes it's not. It's healthy, normal emotion. Studies have shown that people with BPD have a fight or flight response that is easily triggered. The fight response can be that anger. So we perceive something in a certain way and we can get angry. Now, I personally know this because I used to perceive things that would make me angry all the time, especially if I was out and I thought someone was talking about me or laughing about me. And it was just like that. I would just switch. I could be really happy and laughing. And then I was just like this monster. And the thing with BPD rage is not only is it really explosive, I mean, we have intense emotions anyway, so it's not surprising that our anger is also intense, but we struggle to come down from that. So whereas someone can be really angry and then slowly like get over that anger, we can hold on to that anger for a very long time. What was the last bit of the question?
The last one was, how is it different? How is the borderline anger different for individuals who don't have the disorder, who also have anger?
Well, that's basically,
Right.
yes, what I said. Like, it's more extreme. It's really explosive, and it can seem to outsiders to come from nowhere because that's, like I always say, people do not know how we feel. People cannot read our thoughts. So to an outsider looking in, it could seem we are absolutely fine and then we're extremely angry. Whereas actually it might have been going on for a little time, but we might have been unaware of it. So for me, like, was it in the last video I talked about how I would people please?
Mm-hmm.
But then if someone didn't do it people like back for me, reciprocate my kindness, I would build a resentment, and that would just build and build and build until the tiniest thing would cause me to explode. So I knew it had like been gradually building, not consciously. Wasn't aware of it. It's only now that I'm in recovery I can look back and see that over time it was building. But to outsiders it just seems like she's crazy. Like, where did that come from?
Yeah, the anger and borderline personality disorder are definitely different than a lot of the anger we see in people that don't have it or have other disorders. I've noticed that it's very reactive. It's a reactive type of anger, so a little bit different than we see with, say, well, different and similar, I suppose, to antisocial personality disorder that has an instrumental anger, so an anger that has some sort of purpose. In borderline personality disorder, it's highly reactive, so anything happens and the anger is right there. It's always, it really is continuous. It's described as continuous, and that's quite accurate. It's a continuous anger, always under the surface. And where it comes from, it's interesting. I've seen it so many times, and I've seen all these different theories about where it comes from. Is it from the affective instability, that mood dysregulation? Is it a product of impulsivity, which is one of the major theories? Is it a response to fear? Now, you mentioned before, I think in the last video, how important the fear of abandonment is. Like in your conceptualization, it's at the core. In my conceptualization, it's identity disturbance, but I can see the argument. I can see that you can make a good case for either one. And if it is the fear, if fear is the core, and your fears aren't satisfied, that would explain anger as well, right? That the fear is coming up, it's not being resolved, and that state can't be maintained, so the anger comes in because the anger is a very active response as opposed to a passive and a response where you're running away. So it's like a
It's
take
like
control.
the fight or flight response. You either run away, you fear something, or you come out fighting. And unfortunately, a lot of the time we come out fighting.
Yeah, I think in one sense the anger is about claiming control. At least with the anger, you're doing something instead of just being a victim of something, like with fear. Now, of course, the downside of the anger is I've seen it result in all kinds of legal problems, in convictions, criminal convictions, in destruction of relationships, and I think in general driving people away. So that the anger, I think, is probably one of the most observable symptoms from the outside.
Yeah.
That's what people see.
It's funny you mentioned like the antisocial, actually, because like I said, in my book I did a chapter on BPD in men, and what I kind of found was men tend to be more physically aggressive. Not all the time, don't get me wrong, because I was really physically aggressive and I did show my anger physically, but it tends to be more of, like, men seem to do it more. And because it seems like more prominent in men, they often get treated like they have something wrong antisocially. So then they're pushed down the path of prison or getting arrested. Whereas if it shows in women, they're more guided towards something's wrong with your mental health. It's not fair at all.
Yeah, it's probably viewed differently by sex, and also I think that there's an externalization and an internalization. And I've seen presentations of borderline where there's a lot of anger, but it's all internalized into self-harm and part of that impulsivity, and there's not a lot of violence. But sometimes people go the other way, where they don't hurt themselves and all the anger is outward directed. And that's probably the type of anger it's much more likely to get you involved with law enforcement than the internalizing anger.
Well, anger comes in so many forms. It can be like sarcasm can be a form of anger. Just being like making sarcastic little comments. The silent treatment. It's horrible. It's horrible to be given the silent treatment, but that can be caused by anger.
Absolutely, yeah. You could think of it as all the way from like frustration to anger, all the way to rage. And when I think of rage, I usually think of some physical or out of control component, to qualify for rage. But we've seen that. Now that brings me to the next question, because all three of those terms are actually mentioned in the next question. I'd like to know better ways of calming down the rage, anger, and frustration. I'm sick of arguing with my family and loved ones. It's not fair to them. So essentially looking for coping strategies on this topic.
Okay. So, like take this time of year, Christmas, with family around, and it can be really difficult seeing family. If you suspect that you're going to go to your family's house and someone's going to say something, because we all have someone in the family that's just not going to say the right thing, and that can cause us to switch like that, I would say prepare yourself beforehand and think through scenarios. So if there's one person who always seems to rub you up the wrong way, think through the scenario in your head. How are you going to deal with it? And just by preparing yourself that little bit can give you a head start. So you might go there, they might say what you thought in your head they would say, but you've kind of planned what you can do. So it might be turn the conversation around so it's on them rather than it's on you. It could be just remove yourself from the situation and just go for a walk or go and talk to someone else. So you can kind of plan through instances where you recognize that your anger does come up a lot, like you said, with family, friends. Resentments. I said about resentments. Be aware of when a resentment comes up. Now, how are you aware of it? Well, just think. Do you think over something someone's done again and again, and it's like just niggling away? Not enough for you to go rah straight away, but it's there. They irritate you. They've done something, and you go over what they've done in your head every single day. That's a resentment. And you might think it's okay, it's just there, it's not causing you to become really angry, but eventually it will. So let resentments go. And there are ways of doing that. Learning to let them go in a healthy way. And it might be, as soon as someone's done something, talk to them about it straight away. Don't let it build and get worse. There's the counting. So if it sounds ridiculous, but if you all of a sudden feel that coming up, just literally just count in your head to 10. 1, 2, 3, breathe deep just to calm yourself that bit and think, I won't say anything for 10 seconds. And then if after 10 seconds you're like, I want to say something, just say, I won't say anything after 20 seconds. And try that. And it might not work straight away. These skills take practice, but it can definitely just give you that little bit of time to calm enough to realize, actually, there's going to be consequences for my actions, and you've got to kind of buy yourself that little bit of time. And so counting is one. If you think you can't do that, as soon as you feel yourself like about to explode, remove yourself from the situation. Get out of there. Go for a walk. Go for a run. Do something like physical, because often when we get angry, it is our fight or flight response. So that is triggered, and that's why when we get angry we might start shaking with rage. We feel ourselves getting hot, so our body's pumping that adrenaline around, getting ready for us to go rah. And if we don't, we've still got that surge of energy. So for me, I would just go for a full fast run, and it didn't take like the anger out of my head straight away, but physically it was enough to, I released that energy in a healthy way. So yeah, there are a few tips.
Absolutely. Yeah, so really a lot of it's about being prepared for the anger and having some strategies already built up and ready to go. And I think too, a lot of times with borderline personality disorder, you have to expect to be angry. You kind of have to know that's something that's a likely outcome of a lot of different interactions. And if it doesn't happen, then great. But if it does, you're prepared. The other thing about anger I think that's tricky is, because in borderline personality disorder it's such an intense emotion, as you touched on before, a lot of times when people experience emotions, whether it's anger or frustration or rage or happiness or excitement or disgust or surprise or whatever emotion it is, there's this sense that it has to be acted on, right? We see this all the time. People will feel a certain way and confuse that with believing or thinking. So they feel a certain way and they think, well, now my circumstances must be congruent with this feeling. So if I'm feeling angry, I need to lash out and be violent, or I need to yell, right? Just like you see these examples, like where somebody goes on a date. Maybe it's a first date, and one of the people gets really excited. They're really attracted to the other person, and they think, well, since I'm attracted, I need to do something. So they lean in for the kiss, and it's too early, and it's like they get rejected, and it's because they believe the emotion necessitated action, right? Whereas restraint would be, okay, I'm attracted, I'm going to wait this out, I'm going to give it a few days, see what happens, right? And I think you need the same strategy when it's a negative emotion, right? Assuming attraction's a positive emotion. When there's anger, you have to really ask yourself, does it have any real meaning? Is it justified anger, or is it the anger that you would expect because of the distortions associated with the disorder? So
yeah, I think that's important, looking at our perception, because we know a lot of the time our perception isn't always 100% accurate. In fact, a lot of the time it's way out. And I think with recovery, that's when that starts changing. It doesn't happen straight away because we're so used to thinking a certain way about the world around us. But with recovery, definitely.
Yeah, with recovery, the distortions are reduced, and I think the way people process perceptions improve. The way people have the disorder, it improves, so they realize that the way they're thinking about something isn't always rational, and they have sources of information that are objective, like friends or family that can tell them, hey, you might be a little out of bounds, or no, that's fine. Some sort of anchor, and I think I touched on that in the last video. Yeah, those anchors are so important because with borderline personality disorder, in a way, you don't have a compass that reads true north. So it's nice to have those supports to help direct that needle in the right direction, and hopefully over time that the corrections become smaller and smaller, and the person sees things more accurately. But,
and we've really got to want recovery for that to happen, because if we don't, and we have loved ones telling us, whoa, actually you're way out, chances are that's going to really make us angry unless we've sat down and had this conversation and said, you can point this out, I want to recover.
Right, yeah, you have to reach a certain stage in order to employ some of the strategies. Absolutely, yeah. And probably a lot of it is based on insight.
Yeah.
Right, which we talked about before the video, the importance of insight and how that seems to make a lot of difference for people. Okay, so the next question we have here, there's a subscriber that has a sister of a friend, and they believe the individual has borderline personality disorder. There's some rage behavior, and I guess, now I'm not as familiar with the United Kingdom, but apparently there's waiting lists to see individuals who specialize in borderline personality disorder, and they want to see if there's any advice on calming them down as they wait, I guess, to see this specialist.
It's a difficult one because it depends, like I said with the last question, whether they really want recovery. I would say it would be very difficult, actually, with absolute no recovery behind this person, to calm them down when they go into a rage. Just like I said in the last video, if a 3-year-old is having a tantrum and you try to calm them down, they will kick and scream. If a lion is going to attack someone, imagine just going, oh, calm down. It's just not going to happen, because that's why our rage is explosive. So I would say it very much depends if this person's like, are they self-aware? Do they know, like, are they aware of their anger? Do they want to do something about their anger, or do they think the problem is with everyone else? Because depending how they are is like what kind of advice you give. If they are not aware of their behaviors, they're not in recovery, yeah, I would say it will be difficult.
Yeah, you're right. There's a wide range of what's possible based on the insight and the stage of recovery, if there is a stage of recovery there. Emotions are tricky, and a lot of clinicians that I've talked to over the years, when we talk about managing sadness or depression, which of course would be more severe, or anxiety, seem to be pretty optimistic. And I feel the same way. I think those types of emotions, nervousness, worry, depression, there's reasons to be optimistic. But anger seems to have a special characteristic to it where a lot of clinicians believe it's very hard to change, especially in the moment. So if somebody comes in angry, it's very hard to just magically, or even through therapy, make that anger go away quickly. And if you think about it, though, all intense emotions really share this. So if somebody, I mean, to some extent they do, if somebody has like a really incredible thing happen to them, say they win some large sum of money, and they come in, they're like, I'm really happy, I just won all this money, and your job is to make them not happy, it would be very difficult to reason with that intense emotion. But since happiness isn't destructive, we don't worry about that. We worry about things like anger. So yeah, I agree. It's in the moment when somebody's intensely angry, it's tough. The important part would be laying a foundation in advance, and you touched on this before, so that you're prepared for the anger. Because in the moment of anger, it's almost a little too late a lot of the times. They're already angry, just like they're already happy. So it becomes difficult. So I don't know much about the UK system of mental health treatment, but it sounds like I've heard this before, where there seems to be a lot of delays getting in.
2-hour waiting list.
Wow.
2 hour, 2 year.
Oh, I thought 2 hours was bad. Okay, 2 years, that's much, much worse. Yeah. Yeah.
2 years. Yeah, long list. Long waiting list. Unless people obviously go privately, but who can afford that?
Yeah, well, that's That's a tough system. That's a long wait. You're missing all the critical periods of when intervention would be really helpful.
Yeah.
Of the first 2 years, really the first couple weeks would be crucial. So yeah, to go 2 years
Yeah. I mean,
that's
that's
too
for
long.
DBT. But I mean, that's really all that is offered for borderline here. There's not much else, and anything out there else there is, again, it's a long wait. Um, so yeah,
That's unfortunate. All right. Well, we
it
can't
is.
we can't necessarily do anything about that directly, but
But
yeah, I
I'm
guess that.
setting up a website, BPD Tribe, and I'm gonna save the world. That's what I plan on doing.
Well, it's
And
about
we
time
will do.
somebody did.
Well, I want to do. That's why I want to do courses on the individual traits. So, if someone's suffering with anger, there'll be an anger course especially for them, and it's all based around people with BPD. So, because there's a gap, people needing help, like this person that's messaged, they've got someone who needs help, and they've got such a long waiting list. And not only is it destroying the person with BPD, but their family and their loved ones around them. And they're kind of left like, what do we do?
Yeah, yeah. It seems like there's a again, I don't know anything about that system, but that seems to be a fairly catastrophic misprioritization, right? To put mental health on the back burner that far, just
Yeah.
to me doesn't make any. I mean, there's no scientific evidence that supports that. It's beyond reason. But it's the system that you're stuck in, and
Yeah.
to some extent, you have to make it work with that. Okay, so the next question. This person says their ex was diagnosed as a teenager with borderline personality disorder, and they have rage at even just a perceived slight, and also indicate the person is cruel, and they suspect that they're more sociopathic, I suppose here's what they're saying, than borderline. So there's like some concern if that was the correct diagnosis. Is there some overlap into sociopathy?
I personally would say yes, there could be. Obviously, I can't go around diagnosing people. But one thing that I personally have noticed with myself and with other people with borderline is, yes, we might behave in a way that's really destructive, and we might seem to like cause people so many harms, but actually we do feel guilt, we do feel shame, we do feel remorse, we do have empathy. And just because we've behaved a certain way, it doesn't mean after that we are completely, we just don't care. Well, actually, we can hold on to that guilt, and it can cause us to act impulsively, or it can cause us to self-harm, etc. But I think you hear it all the time. It's your typical, stereotypical someone with borderline is they're cold, they're heartless, they're cruel. And that's so far from the truth. Like I say to people, just like two people like without borderline can be so different, two people with borderline can be so different. Maybe the cruelty could be put down to something else. Maybe antisocial could be. Maybe they're just not a nice person, and that sounds really, really harsh. But there's good and bad in everyone. You can meet people with borderline that are the nicest people in the world. Now, people that have been hurt by people with borderline would be like, they are not nice. But I don't care. I stand by what I say. I've met some people that have no mental health diagnosis, and they're horrible. They are actually not nice people. So yeah, it could be a number of things, but it might just be they're not nice.
Yeah, it's interesting with the cluster B personality disorders because oftentimes we would expect comorbidity with a disorder like borderline personality disorder, like substance use disorder or major depressive disorder, and sometimes other cluster B personality disorders like histrionic, sometimes narcissistic, and of course the last one, antisocial, which is really the strongest correlate to the construct of sociopathy. And with those symptoms, we really see criminality and irritability and aggression, violating society's norms in real blatant ways. being irresponsible, and we also see a shared characteristic, impulsivity. Except it's not in two areas that could be self-damaging, it's just impulsivity in a more generalized sense. So I think in some cases, of course, somebody could have borderline personality disorder and antisocial, or they could have antisocial features. So they could have just a few of those symptom criteria and not have others, so they wouldn't meet the diagnosis, but they would still exhibit some of the traits. Now, it's interesting you mentioned like the coldness that sometimes people would think is characterized in borderline personality disorder. I have seen that a few times. I would agree with you. That's not something I would expect to see with borderline personality disorder, the coldness. But in times where we do see it, perhaps that's an overlap with psychopathy, right, which isn't really covered in the personality disorders because antisocial personality disorder is different than psychopathy. There's some overlap there, but it could be that too. Somebody could be psychopathic as well as having borderline personality disorder, and you could see some callous, unemotional features. The reason I don't think we see that a lot, though, is because in the definition of borderline, we see emotional dysregulation and unstable relationships. So by definition, there's an experiencing of intense emotions, like you touched on before.
Yeah.
Whereas with psychopathy, I would expect to see somebody who's cold, callous, calm, very, very low neuroticism, and calculating. So they don't really seem to go together as well as like antisocial personality disorder and borderline. So interesting. So we're at the 33-minute mark at this point. We did cover a few questions. I think we covered them from a lot of angles. I think we got some pretty good descriptions in there. Anger is certainly a topic where there's a lot of questions because, again, the effect it has on people. So if you would like us to do another video on anger, maybe we can follow up later and put your comments in there if you have any additional questions or if you want to add anything to discussion. We'll be continuing on with the series, looking at the other symptom criteria. So if you have questions about that, please incorporate those into the comments as well. And of course, we have comments that were made previously. So we have a lot of ideas for those videos. And again, I'm so thankful for that. It's nice to have these good questions to drive these interesting discussions, or at least I hope you find them interesting. So once again, Sharina, I want to thank you for spending this time with me and answering these questions about borderline personality disorder. Anything to add before we go?
No, thank you so much. It's an honor to be here.
It's absolutely my pleasure. So we'll be working on more videos. So again, thanks for watching. Please make comments, and we will see you soon.